Hi, hello everyone. Welcome to Bibliobasar's presentation on stroke. This is John with you. I will discuss about stroke in this video session. So this is a mind map session. This is a new playlist I'm starting. The mind maps discussing on the videos will be uploaded to Basar Biblio's library. So there is a group there in our community for nurses. So please visit Basar Biblio and check for nursing community. So you can find all these PDFs and quiz cards. Everything we upload on social media will be available on our website. So once again, welcome you all. So now I will go to that topic. So now we'll discuss the topic. Okay. In this presentation, we will discuss about stroke, different stroke and its causes and its signs and symptoms, treatment, diagnosis, and management of nursing side. Okay. So once again, welcome you all. So stroke is a medical condition which is a lack of blood flow to the brain, causes cell death. There are two main types of stroke. One is ischemic and another one is hemorrhagic stroke. So both can cause brain damage. The causes of stroke, the main causes are hypertension, atherosclerosis, smoking, and diabetes. We have hemorrhagic and ischemic stroke. So we will discuss it later. Initially, we will discuss on common factors. Okay. The common stroke signs and symptoms are First means facial droop, arms will be weakened, then slurred speech, and person will be confused. He will lose the time orientation. Okay. Then sudden numbness, weakness, trouble in speaking or understanding. Okay. The diagnosis is CT brain or MRI or other blood test can detect the stroke. Okay. The initial treatment are if a person gets strokes, he need initial emergency attention. So immediately when the first 1 hour is the golden hour, so immediately we should ship them to emergency unit. So first initial need is medical attention. Then the second one is thrombolytic medications. If the patient is getting ischemic stroke, they will get antithrombolytics and antiplatelets, anticoagulants. Then if the clot detected, they will do, sometimes they require thrombectomy as well. Then blood pressure should be maintained and control blood pressure. Then surgical interventions, if the patient has aneurysm, they will do clipping. Then if there is a hematoma, they will remove the hematoma by doing craniotomy or craniectomy. And rehabilitation, supportive care, medication and stains, lifestyle modification, patient education, all this comes under the management. Okay. So in the nursing diagnosis, there are three main nursing diagnoses coming under the stroke. There is impaired physical mobility, ineffective tissue perfusion, impaired verbal communication. So the interventions are monitoring vital signs, administering the medications as prescribed, as it is as before we discussed. We will give anticoagulants, antithrombolytic agents, and antihypertensives as well. So then assist for rehabilitation and provide communication assistance. and that's all the nursing management. So next again we will start with ischemic stroke. Okay, ischemic stroke is a blocked artery can cut off the blood supply to a brain, so the brain tissue will lose blood supply, so it will cause stroke. The causes of ischemic strokes are atherosclerosis, build-up plaque, cholesterol, fat in arteries, narrowing or blocking the blood supply. Okay, then thrombosis, formation of clot within a blood vessel supplying of the brain. Then embolism, traveling blood clot, embolus, which forms another part of the body and it moves to the brain arteries. Then other small vessel diseases, damage to the small vessels in the brain due to any other conditions like diabetes or hypertension. Then cardioembolic causes, mostly cardiac patients, blood clot originating from the heart and which is like atrial fibrillation patients, the clot will be migrated to coronary artery, sorry, carotid artery. Okay, then artery dissection, tear in the artery while leading to formation of blood clot. Then hypercoagulable status, that is conditions like a patient who's having cessation of blood clotting, mostly the smokers will get such. Then vasculitis, inflammation of the blood vessels affecting their structure and function, so it will lead to blood clot formation. This also lead to ischemic stroke. Okay, then the signs and symptoms of this ischemic stroke. Signs and symptoms are same, both signs and symptoms are same, so I didn't mention it here. So both strokes will come with same signs and symptoms. So fast and weakness is the main signs and symptoms, and the diagnosis of ischemic stroke will be CT scan will show the affected area, and MRI also will provide detailed structure, and the cerebral angiography will give visualization of blood vessels. There is blood clots or blockages we can notice. Lumbar puncture not used for this. Then blood test elevated markers, stroke markers can be identified to rule out the stroke. Then EEG is abnormalities of brain can be detected, and the other one is okay, the treatment of ischemic stroke. The ischemic stroke can be treated with same as we discussed before, administered with anticoagulants, antiplatelet drugs. So we will prevent blood clot formation, and thrombolysis will be done, or thrombectomy also will be done, and rehabilitation. These are the ischemic stroke management. And in the nursing management, neurological assessment, regular monitoring of neurological status and vitals monitoring, and then especially the blood pressure and respiratory rate should be monitored. Then administer thrombolytics prescribed. Then mobility and positioning patient. If the patient affected too much, where they require frequent positioning to prevent the mobile source and early recovery. Then if the patient has any swallowing difficulty, we need to feed them accordingly or suggest doctors for the artificial feeding or tube feeding measures. So watch for signs of increased intracranial pressure. Usually the intracranial pressure increased, patients will be distressed. So then pupils can be monitored. Then at least 4 hours once the patient GCS will be monitored. Then collaborate with the physiotherapist, occupational therapist. Then education and support, educate the family about the condition and the recovery needs. Okay. So that's all about the ischemic stroke. The next topic is hemorrhagic stroke. Hemorrhagic stroke is same as the ischemic stroke. Little change is there is a forming clot, here is bleeding. So in the hemorrhagic stroke, blood vessel can leak or burst. So the blood will spill into the brain tissue and surrounding of the brain. The causes are same as before: the hypertension, atherosclerosis, or aneurysm, smoking, diabetes. Okay. Over treatment with blood thinners. So if the patient is a cardiac patient, usually get aspirin. So if we are over treating with the blood thinners, there are a high chance of this hemorrhagic stroke. If the blood pressure shoots up, they will get bleeding in the brain. So bulges or weak spots in the blood vessels can cause aneurysm, which will lead to rupture of aneurysm and stroke. So trauma like accidents also lead to stroke. Then protein deposits in the blood vessel wall lead to blood vessel weakening and it will lead to stroke. So ischemic strokes also maybe the clotted blood will obstruct the blood flow, so it may lead to stroke again. Okay. So the signs and symptoms are same as before we discussed, the fast and the other weaknesses. So we will move on the treatment. We will move on diagnosis. So CT scan to reveal hyperdense areas due to the blood presence of blood. Then identify the bleeding. Then MRI identify the location of the bleeding, and cerebral angiography can be done to identify the source of bleeding. Lumbar puncture can be done, usually avoid initially due to risk of herniation may be necessary in specific situations. So lumbar puncture can be avoided. Usually the meningitis cases only we will do. Okay, the blood test reveal changes in the blood count, clotting factors will help to diagnose hemorrhagic stroke cause. So then EEG not recommended usually. If the patient has a seizure, usually they will recommend to monitor the patient's abnormal electrical brain activity. Okay, then the surgical intervention, usually the hemorrhagic stroke requires emergency surgery, like if the patient had a hematoma in the brain after bleeding, so they will remove the blood clot, and some patients will be like too much brain edema, they will do craniectomy or craniotomy, and aneurysm clipping, coiling they will do according to the condition. Some patients they will do open, some patients they will do with interventional radiology. So the blood pressure control can be prevent further bleeding. So control the we should focus on the blood pressure always for stroke patients. So depending on the causes, the patient bleeding tendency should be identified and treated. Then the rehabilitation should be initiated and monitor the vital signs. And the nursing interventions are neurological monitoring, frequent assessment of neurological status, then vitals monitoring, strict blood pressure control is important. And post-operative care, we should maintain aseptic if the patient has undergone surgery. Then seizure precautions, the patient should be monitored for seizure activity, and hydration is important, and DVT prevention. Encourage the patient to mobilize as soon as possible because the patient will be all anticoagulants will be on hold, so early ambulation should be initiated for the hemorrhagic stroke patients. And the education and the support to the families as well important. Okay, guys, if you like this mind map of stroke condition, please like and subscribe my channel. If you want more mind maps like this, please follow my website, visit bazaarbiblio.com. So the PDF link will be available in the description. You can go to our website and download. Okay, thank you. Thanks for watching.